am Leslie, the Liaison RN, here linking you to better health. My goal is to help you become the best advocate for yourself and your family's healthcare needs. I'm going to make tons of videos. I've built a huge website, so go check it out. And if you like what you see in these videos and you find the information helpful and useful, please like it and subscribe to my YouTube channel, because I'll be putting out videos frequently that give you all the tips and the tools you need to be that advocate. So here are the top 10 questions to ask your provider. First one is, what can I do to improve my health? What can you do? So this seems very simple. Eat better, don't smoke, don't drink, all the things that you see and read about. But maybe you have something in your health history that you're unaware of, like a genetic thing, that's something that's with your family history. What can you do now to help prevent things happening in the future? Also, if you're going to your appointment, see if you can get your labs drawn before your appointment. This is huge. I do it every time. Let's talk about the labs at my appointment so we can make a plan from there on out. Third question. Do you have a consent form that I can review prior to having surgery? This seems like also another simple thing, but a lot of people don't read their consents. They go to surgery and they just say, yep, doctor said this, doctor said that. But see if you can get a consent before your procedure so you can read it, understand it. If you have questions, then you can bring that up to your surgeon before the procedure. You could also just Google standard surgical consent, and you can see what, basically, they're all very similar, but areas will be filled out that pertain particularly to your surgery. Question number 4. Will there be an assistant or another physician involved with my surgery? If so, who? So I come from a surgical background, obviously. That's why some of these questions are guided towards that. There are oftentimes extra providers in the surgical suite with you, with your surgeon. So you have the right to know who's in there, who's going to be doing what. Sometimes there are emergencies or situations that come up where you won't know who's in there because you're under anesthetic. They're not going to wake you up to tell you that Dr. Hansen came in to do this part of the procedure. But primary people in there that they know and are scheduled to be in there with you, even includes vendors, assistants, PAs, all the nurse practitioners, anybody that's assisting. You have the right to know who's in there and what their role is while they're in there. Question number 5. Can I please have your business card or contact information? I think this across the board is great for any healthcare environment. So let's just say you're hospitalized. I highly recommend each provider that comes in to talk to you or do a treatment care for you or some sort of care plan with you, get their business card and, write down what they did, what they suggested, and then you will have their contact information on the other side of the card. If they don't have business cards with them, I always suggest everybody have a healthcare diary or a healthcare journal. You could write down the doctor's name, better yet, have them write it in your book for you, and then what their services are. That way you just keep track of what's going on with your healthcare and who maybe you can follow up with after you're outside of the hospital setting. Question number 6. Is there any financial assistance available? There's lots of assistance available. A lot of people don't know this. They just assume health insurance versus no health insurance. However, a lot of hospital systems do have financial assistance. You just have to ask for it. And I highly suggest ask for it before you have a planned procedure. There can also be some sort of discounts and stuff that you can find. Question number 7. Will I need follow-up care? And if so, who and when? I see this all the time in the recovery room. Patients don't know who they're supposed to follow up with. This is important to know beforehand, because say it's physical therapy that you need to follow up with. You got to get that arranged before you even before you have your procedure. If it's an elective or known procedure that you're having. If it's something you didn't know you're going to have, it, say you broke a leg or something and you had to get flown into the hospital and they did emergency surgery, you don't know. That's not what I'm talking about. I'm talking about if you are getting a hip replacement, you're going in for surgery, have your physical therapy lined up for immediately after your discharge from the hospital. Number 8, can someone please show me how to connect to my electronic medical records? So there's basically the right for patients to know basically everything in their electronic medical record. It's called an EMR. And you can see the notes that the doctors are writing, that the nurses are writing. You can see your lab values. Oftentimes I'll have a patient in the hospital and they'll know their lab results before I even get them. So it's kind of funny. But know how to use this very, very valuable tool, because you can get your x-ray results, you can get like I said, lab results and so on and so forth, and your medical plan and medications, and you can even go in and adjust things on some of them. Like I have one provider that I can't go in and change my meds. They always say I have the same meds every time. Every time I tell them it's different. I wish I could just go into that medical record system and change it to what it actually is. So yes, I get frustrated as well. I have a referral to a major medical, university medical system. And after the referral went in 2022, they reviewed it. And I just got a letter this year, 2023, that they received my referral from my doctor. And unfortunately, they cannot accommodate me because they have no appointments available for over a year. So I'm still stuck in limbo. So what you need to know is, what do you do in the meantime? So what I've been doing in the meantime is I'm journaling everything that's happening to me, that's my health, so that when I actually do get to go see this specialist, I will have all my information for 3 years, maybe 4 years worth of data about my condition. And they can review it. Hopefully they can come up with a treatment plan for me. And number 10, when will I be notified with results? So let's say you cannot access a medical record. Who's going to notify you and when? A lot of patients wait around waiting for a response from their doctor. They'll call them, no one responds, and they just want to know, what did my CT show? What did my, is my cancer still here? It's really, really difficult mentally to have to listen and wait and wait and wait. So ask your provider, when the tests are being done, when will I be notified and how? Is someone going to call me? Will they leave a message? If I authorize a message, will you please leave a message, because I don't answer a lot of my phone calls. And that's some really, really important information. Again, go to my website, tons of information. I have lists and lists of products that you can use, and start your journaling now, so that you can write down what conditions you have, what events surrounded the symptoms, the reactions, and then that way you have a better idea of what you can bring to your doctor's office for your follow-up visits. So this is just video number 1. Like I said, I'm going to have tons of videos. Please like, subscribe, go to my website, theliaisonrn.com, and just take a look around. Again, I have tons of information, documentation, paperwork, how to build its go bags, how to be prepared for medical emergencies or planned visits, how to be best prepared for doctor's appointments. Again, I'm Leslie, the Liaison RN, here linking you to better health. Take care.